I am Janete. I'm a dentist by profession. My motto in life is that creating smile by educating people as we glorify God is my mission, because every tooth and every soul, I believe, deserves care. It's not just our spiritual, it should be also our body. And in my case, I see people, 20, 30 patients in one day. This is my main focus, and I want to share my knowledge with you today. All right. One of my favorite verses, that's why I skipped the memory verse, because I want to share this one. One of my favorite verse is from Proverbs 17:22. Can we read it together? A cheerful heart is good medicine, but a crushed spirit dries up the bone. Yes, and because of that, I just want us to be happy. I know this is the wee hour of the day, and we tend to be sleepy. So I want everyone to stand up, please. Stand up, all right, and then can you tell to the person around you, thank you for making me feel at home in this church. Thank you. All right, thank you so much. It's so good to see people standing up, reaching out to our families and friends here in Hong Kong. Okay, now that we are all awake, okay, I would like to continue to the next slide. Okay, right. Okay, just a quick background of myself, all right. I graduated in Bachelor's of Dental, Doctor of Dental Medicine in UE, Manila. Then, later on, I studied dental externship in surgery in UP PGH. Anyone knows PGH here? Yes, this is a public hospital in the Philippines. So, this really caters to the poor and moderate level usually. And people don't pay, just for the knowledge of non-Filipinos here. That's why I really chose this one for me to give the service to the community. Having so much trauma and accidents in the surgery department, I try to expand my knowledge more in the TMJ, wherein when the patients fall, get an accident, and they damage their TMJ. So this is another branch of dentistry. So I continued one more time in UPPGH again and took the TMJ training course. Then I also went into intensive program in endodontics. Okay, these are the root canal treatments. More advanced techniques in saving teeth, so in case you have any concerns, you can ask me afterwards. Okay? Then, of course, after that, my love for cosmetics and aesthetics grew bigger and bigger as the time goes by. Why? Because handling so many patients who suffered from trauma, like people who broke their jaw, we do in operating room, we put it back, and then they lost their teeth, they lose their confidence. And so my passion in bringing back the smile grew, and so I took cosmetic dentistry in Central Escolar University in Makati. And then of course, these are hand in hand in dentistry. I also took orthodontics. Those who are asking if I do braces, yes, I do. Majority of my cases in my clinic is braces and cosmetics, then surgery. Then lastly, I did some Invisalign here, more advanced way of closing gaps, clear aligners here in Hong Kong. Okay, so Hong Kong is very close to my heart because it is very close to Macau, the nearest place to go. Okay, so I started my work in St. Luke's Medical Hospital in my professional career. Gradually, I took over into private practice until I opened up my own clinic in Macau named Luxicare Dental Medical Center. Since so many people were asking a while ago, I'll just put it up here. Okay, so just to clear things up. All right, so before I continue, let's bow our heads for a word of prayer. Dear Heavenly Father, thank you for gathering us in this place to learn more about the importance of dental health. Please guide me this afternoon and use me, O Lord, in your health ministry and put the right words into my mouth so that I may deliver this lecture according to your will. May we all ask this in the beautiful name of Jesus. Amen. Okay, so have you noticed the first thing you see in the person is the face, right? So I want to ask you something. Do you notice something missing here?
Yes.
What is it? Tooth, right? Correct. Clap yourselves. Clap yourselves. That's the first question. How about this one? Have you noticed that he's also missing an eyebrow? Yes, right? But the first thing was the tooth, because when it comes to the face, the first thing that people will notice is your smile. So, dentistry and oral health is a very big factor in our daily life. Okay, this is something I forgot to ask Brother Chileka. The age range is this in this group. Okay, did you know that so many names now is arising? Unlike before, all I know is that if you're old, you're middle, and you're young. That's it, right? But now we have different generations. So just a quick preview. Age 70, they call you builders. Do you have age 70 and above here?
Yes.
Oh, really? How old are you, ma'am?
4.
Oh, congratulations. Very young at heart. And then those we call baby boomers are aged between 59 to 69. Who's 59 and above here? 51. 51. Ilan po? Oh, at least you are called baby. It's just that baby boomers. Okay, age 36 to 50, you are the Generation X. Don't forget, you will never be forgotten, okay? And age 21 to 35. Who among you? Me too. I'm 34 and we are in the Generation Y, or the commonly called millennials. I didn't know I'm part of the millennials. I thought it's for the younger people. Next is the Generation Z, between age 6 to 20, which is rampant in this church. So many kids are from 6. And then my son's generation, age under 6, Generation Alpha. Okay, so now I want to concentrate first for the Generation Alpha, but just quick preview, okay? How many of you are taking care of kids under 6 years and below? Have in workplace, niece, nephews, kids. Okay, quite a few. Okay, did you know that they are the hardest people to handle anywhere else in the world? Even more than an angry adult. You can deal with an angry adult, but not with a crying baby on the floor. And can you imagine us treating them in a dental setup with all the machines, all the sharp objects? It's one of the most impossible things. But we can handle that if you will help us. Parents, aunties, uncles, please help the dentist so that it would be easier for us and for the children to handle this situation. So, I just want you to know that there's such thing as early childhood caries. Have you seen a child with all the teeth almost brown due to caries, right? Do you have anyone in your house with that? So if you're taking care of a child, this is not because of the child. This is because of how we took care of them from the day they were born until they have maybe reached 2 years old. So, what are the causes of this? Can breastfeeding cause this? How about baby bottle feeding? Number one cause is baby bottle feeding. When you feed the baby at night and you don't replace that with water or brush their teeth, even if you brush during the day, they can develop this. However, new studies are showing breastfeeding have sugars as well. So if you are breastfeeding, you know someone breastfeeding, let them know to wipe the gums, wipe the teeth, or let them drink a little bit of water if they are allowed already. Why? Because they can suffer from this as well, which is, first, it's not nice to look at. We call it ugly. Second, it's painful for them. So don't let them suffer. Okay. Alright, so just a quick timeline for the kids, since I saw a lot of kids here. Between 6 to 10 months, that's the time the first teeth erupts. Then, there's the most important time, between 8 months to 33 months. Okay, this is the time you have to keep the teeth for your children. Okay, why? Because once you remove it early, there are many things that can happen. First, it will delay the growth of the teeth. So you think, oh, she lost her teeth in a young age. How come she doesn't have teeth until now? Because you lost the tooth early on. And the tooth, the permanent tooth that is coming, doesn't know where to go. God is really amazing. He put the direction where the permanent tooth is coming out. It's like this and this. If this one is not here, this tooth doesn't know where to go. Just like us, they need a leader. And that is the baby tooth. So it is very important to keep them until it's about time for them to be removed around maybe 6 to 7 years old. Then by that time, they will have mixed dentition and all of that. Then the kid may suffer a little bit of discomfort, such as crowded teeth. You will say, how come my daughter has crowded teeth? None of the family has one. It's because you did not take care of the teeth of the kids properly. That's why they lost it early. Okay? Then, this one I discussed a while ago, just the rule of 2, brush 2 times a day, 2 minutes. This one goes for the adult as well, okay? Not 2 weeks. I have patients who brush their teeth 2 times a week. I think they did not get the memo. It should be 2 times a day, 2 minutes, and visit the dentist 2 times a year, because even if you clean your teeth, there are cavities, dental plaques that will go inside the tooth that you cannot clean anymore. Okay? So here, this is just for the kids that I discussed a while ago. Now, let's go for the adult teeth. Painful tooth. Simple. Back in the day, what will you do? Remove it, right? How many of you, can you raise your hand if you did removal of tooth, especially for the Filipinos? Oh, it's so painful. I feel sensitive. I don't like it. I go see a dentist, remove. No more pain, right? Yes, because there's no more tooth. And now, you have a problem. Why? Because it is more expensive. Now you have to get a denture. Someone asked me about denture a while ago. And the denture, you have to replace what? Every 2 years, every 6 years, every 20 years, depending on your usage and your age. The expense and the suffering and the healing just continues and continues. So why not? Let's change that mindset. Okay, so did you know that losing the tooth and the teeth may give you more bad effects? Not just the aesthetics, not just the expenses, but also some TMJ functions. Okay, I know generally most of you know that if you don't have teeth, it's not good. You cannot eat properly with dentures. But did you know that if you remove your teeth, this part of the upper jaw and the lower jaw will have decreased space? You know the grandparents, yes?
Yes.
A little bit, you are going a little bit technical. TMJ, the temporomandibular joint.
Yes, yes. Yes.
Yeah.
Okay.
I'm saying TMJ, so they're wondering what is TMJ.
Oh, I see. Okay. So the temporomandibular joint is the one that you hear here. Can you point your finger here in front of the ear? And you open your mouth? Did you hear any click?
Yes.
That's not good. This should not have click. Okay, this is the reason why you should not be losing not even one tooth in your dentition or in your mouth. I saw some here who are wearing dentures. Who among you are wearing dentures here? Especially full dentures. If you do that, the upper teeth, thank you so much for mentioning, upper teeth and the lower teeth, so if it's like this, if you lose your teeth, it will go like this. However, can you see in the picture? There's a joint here, which we commonly call the TMJ, temporomandibular joint. It will click out of the bone, just like your knees, right? When you get older, you have osteoporosis, sometimes it clicks. It means it's going out of the socket, just like this. So if you move like this, if you don't have teeth anymore, it will go out. Supposed to be, if you have healthy teeth, this bone will protect it. If you lose your teeth early, your jaw will go, the condyle will go like this, the bone on the TMJ, it cannot hold it. Now, you're having clicking of the jaw. That is just a minor sign. Don't do it regularly and check. you will have problem later on. So just to let you know that that is a minor sign, okay? Then, because of that, you will develop certain problems, okay? Have you noticed, there are times when you're so stressed and you are clenching your jaw, suddenly you have headache. Then you have backache. Then you have shoulder pain. Then you should have lower back pain. Why? They are all connected. Once you have lose your teeth and you don't do the dentures right away, or fix the tooth right away, your jaw will collapse a little bit and your spine will also fold. So, your posture will be bad, some nerves will be impinging inside. That's why, no matter what you do, no matter how many massages you do on your back, it's still painful. It's easy to blame it in our job. Any job will give you back pain. But without any cause, headache, back pain, jaw pain, it could be one sign that you have a TMJ problem. Okay, so the next one. So what can we do? Okay, so I want to share the solution and reliefs that you might encounter later on in life once you were diagnosed, or if you feel that you have some signs of this. Okay, first, jaw massage. It's really good. Okay, I want you to lift your right hand, close it like this. You see these knuckles? Put it under your cheekbone, and then open your mouth. Close it. Did you feel a hard muscle here?
Yes.
That's your masseter. That is the muscle responsible in opening and closing. That's the part that we need to massage. So what you will do, put it there again, and then massage it slowly. Okay? Slowly from up, going down, up, going down. The technique is you do this one 3 times a day for 15 minutes, then do hot compress again. Hot compress 15 minutes on, after that massage, and then hot compress again, massage for 3 times. For 3 times a day for at least 10 days. You will see a sudden relief in your jaw. Okay? So try this one if you feel like you have clicking of the jaw, and try not to yawn too much. Try not to laugh too much. I'm so sorry, brother. I know you're a happy person, but especially Filipinos, we laugh like this, ha! And it can actually affect the jaw. So, we have this thing called laugh like a dalagang Pilipina. You know that? It's a young lady in the Philippines, like you're a shy girl and just like, ha ha. Just like that, okay? Dalagang Pilipina, know the term, okay? Whenever you feel like your jaw is painful, you say, oh, maybe I need to be dalagang Pilipina today, okay? Try to do it at least a week and you'll see you will feel better, especially in your jaw. Alright. Second one, the other one, more advanced, are like splinting. You need to see the doctor for that. Wearing mouth guards at night. Very common you'll see Manny Pacquiao, right? He's always wearing mouth guard because he's protecting the temporomandibular joint. Okay? But the other one is the breathing technique. Why? Whenever you feel stressed and whenever you're angry, how do you look? It's like this, right? You're clenching. Unconsciously, you are clenching your jaw. And so, this will stress the muscle. So, other than doing the massage, I want you to do this rule of 4. This time is for the adults. I like numbers, but math is not my thing. You know, just 4. Rule of 4, breathing technique. I want you all to stand up, okay? So, we can wake up a little bit. Okay. Number 4. First, I want you to inhale through your nose for 4 seconds. 1, 2, 3, 4. Hold it for 4 seconds. 1, 2, 3, 4. Release it for 4 seconds. 1, 2, 3, 4. And then you do it 4 times. By doing so, you are doing a breathing technique. Let's do it one more time. Inhale in 4 seconds. 1, 2, 3, 4. Then hold it for 4 seconds. 1, 2, 3, 4. Breathe through your mouth. 1, 2, 3, 4. And then sit down. Do you feel relaxed now? Yes, a little bit, right? Can you imagine if you do it 4 times before sleeping and after praying, right? you will be more relaxed. And these are free and simple ways that you can do, okay? So, if you feel stressed, always think, my teeth is gonna hurt, my teeth is gonna hurt, my back's gonna hurt. I need to do the rule number 4, okay? Remember that, okay? Alright, so next slide. Okay, did you know that dental caries are the most common chronic disease in the world? It's just second to common cold. You know cold? You sneeze maybe every other day, every week, especially when COVID hits, right? But even that, dental caries, bulok ng ngipin, broken tooth holes, is the #1 disease in the world. A staggering of 1 billion people globally suffers from it. And like what Brother Chileka said, I hope that we don't have gingivitis here. You know, gingivitis is the swelling of the gums. Sometimes when you eat, you're like a vampire. There's some blood coming out of your canines. And then sometimes you feel like your gums are so itchy, right? That's one sign of gingivitis. But did you know that 50% of Americans suffer from gingivitis? And this is a first world country. It means they have the capacity to pay and have it cleaned maybe 2 to 3 times a year. And even 8 out of 10 patients have dental caries. And I can testify to this. I agree to this. Why? Whenever I see a patient, it's impossible that I don't see at least one cavity. Cavity means in bulok, decay, sira. Okay? And half of my patients, I would say, have gingivitis. That's why we do cleaning all of the time. Within the day, I would say 5 to 6 patients just for cleaning alone. So, I don't want you to open your mouth now, but later on, once you go home, check your teeth. I'll show you some, the picture is here. Always check the inner part of your jaw, lower teeth. Okay, here, check. Put a flashlight, look at the mirror, maybe take a photo. If you see even just a little bit of discoloration or white, you see the yellow one, that's the dental plaque already. That is very dangerous because behind that are millions and millions of bacteria. We call it Streptococcus mutans mostly, but these have more side effects later on. So, later on, if you have a good friend and you cannot see it, ask a friend, can you check? What did I eat today? I think it's delicious. I think this is the samosa. Okay, so try to check yourself, and then if you see at least one, go visit the dentist right away. Okay, this is a more severe one. So for this picture, I would like to let you know how tooth cavities, sira in Tagalog, can be created. So first you need, of course, you need to have tooth. If you don't have teeth, no need to worry. That is, eat chocolates, come on, it's okay. Alright, but if you have tooth like this, first you need to have sugar. Sugar comes from where? Candies? Oh, dog, I don't eat candies, I'm adult. Chocolates? Maybe only February. How about milk tea?
Yeah.
How about boba tea?
Yeah.
Right? This is very... Rice. Do you eat rice? Oh, very healthy here. Okay, rice, carbs, chocolates, drinks. Orange juice, which we consider healthy, are rich in sugar. So basically, most of the things that we eat are actually containing sugar. So that's where the sugar is coming from. Don't think that it's just the table sugars and sweets, okay? Next is time. You see, even if you don't brush your teeth, you're okay the next day. But give it a week, you have bad breath already. It takes some time because we have the saliva inside the mouth giving us a natural cleansing effect. Okay, so if you lose that saliva, you lose that cleansing effect, that's the time we will have bigger problem. Then the bacteria comes in. Like what I said, Streptococcus mutans is the #1 leading cause of that. If you have these 3 things in here, then you will have a cavity. And you see that one over there in the molar. Is it big? For you, is it big? Yes. Yeah, it's quite big, okay? So, if you have this kind of big cases, what I want you to do is to avoid this food, okay? One of the causes of this, first, it's really far. You cannot reach it. That's why teach your kids to brush more and monitor them. Second, tooth snacking. You know, people love snacking, especially Filipinos. Check their bags. Do you have snack there, sister? What is it? Can you share with us? Right? Fruits. Okay, even fruits, okay, except for apples, carrots, celery, they are good to munch, and even singkamas is also good. But other than that, it's not so good. And Filipinos mostly have maybe candies or some sweets that they will last them for the whole day, okay? So what should we avoid? So there you'll see it, I don't want to mention again, but what we need to do is eat raw, crunchy vegetables. Oh, vegetarian. Who's vegetarian here? No one? One. Okay. But Adventists, we eat a lot of vegetables, right? But what do we do with it? We fry them. We stir fry them. And we coat them with all the things that we can imagine. Okay, now the healthy vegetables turn into a bad one. So even if you eat vegetables and it's not in the raw state or in maybe just boiled state, it still could be harmful for you. It's doing more bad than good. Okay, so always go for maybe boiled, if not better fresh, crunchy vegetables, nuts. Meat is actually okay if there's less fats, and then eggs. Okay, but the best one would be water. If you eat all of this, and again, you are outside in the church, you're at work, and doctor, my boss gave me tons of chocolates and asked me to eat right there and then. What will you do? Drink water. You will make sure that 50% of chance will go away because you try to dilute the sugar, you try to dilute the acid, and then it will be better for your teeth. Make sure to swish it a little bit. It's up to you if you want to swallow. For me, I prefer spitting out. Okay, but anyway, it's your water. Don't worry, it's okay. But again, milk tea here in Hong Kong is very rampant cause of tooth decay in teenagers nowadays. Okay. Next one. Okay, risk factors for tooth decay is this. Pain. Lack of pain. Why? Because sometimes, even if we have infection right there, you don't actually feel it. Have you ever experienced you have like a pimple here inside? And then, it's not painful, doctor. That's why I don't see the dentist. Okay, sometimes you have crowded teeth. It's hard to brush, but there's no pain. Maybe you have old fillings, and yet you feel like you have bad breath, but you don't see any cavity. Okay, these old fillings, first you have to refill or fix with your dentist. Why? Sometimes it's just covering the bigger problem is inside. Crowded teeth, it's hard to clean, and some parts of it you cannot see. You don't even know if it's destroyed inside already. And third, painless. Most of our infections in the dental cavity is painless until it's very serious. Okay? I think you will be even more bothered when you eat something sweet and something cold, you feel sensitive. Go to see a dentist because there's discomfort. But if you see a pimple inside and you don't feel pain, will you go to dentist? Right? I'll just send it to the Philippines doctor. It's graduation time of my daughter. I'll just fix this later on. Until one day, you experience this. As a hospital dentist, this is something that I see on a daily basis. UPPGH, St. Luke's Medical Hospital. What is this, doctor? Intubated patient. Meaning you are in the operating room, intubated, because the infection that used to be painless is so big that it's hindering the throat already. That's why it's very dangerous if you were to choose between upper and lower tooth cavity, fix the lower first. Because here is near the neck, near the throat. If this one gets inflamed, you cannot breathe. And that is fatal. You can die from it. So what I always say, if you cannot breathe, if you have like big lump here, go to the emergency room right away. because it's not something that you need to ignore. Okay, another one. This is a simple tooth cavity, right? But look at her. That is facial cellulitis, meaning because it was painless from the beginning, it just gradually increases and breaks the bone, breaks the down, goes to the face, to the cheeks, to the point that she cannot open her eyes anymore. This is facial cellulitis that could be painless, even up to this point. Okay, some are painful, some are painless. So, people will only come, doctor, I don't know why my face is swollen. Maybe I have allergies. Can you imagine? This was considered allergy. Allergic reaction to something cat does. We don't know. But then the origin is from the tooth. So, these are the types that are more serious. So, that's why pain is our best friend when it comes to teeth. Why? Because it's the body's alarm system. Have you noticed if you have a problem, what will you do first? You pray more, right? If you feel like, oh, Lord, I lost money, it's so painful in my heart, I cannot give money to my family back home. Lord, I promise if you give me money, I will go to church early next Sabbath. You pray more. You ask more. You require something more. You do something about it. You even go to the godly way. Why? Because it's painful. But without pain, if you're happy, admit it, we pray less.
Yes.
We pray less. At some point, some people, they forget to pray. Okay, so pain is equals to our best friend. It's our God's way of reminding us, something is wrong, brother. Something is wrong, sister. Fix it. Because God put the pain in your body to remind you that you have to take care of this body of temple of God. Okay? Alright. So, another risk factors is maybe type of fluoride. Very quickly, I want to know who here is from Canada. Now, how about from the Philippines in Cavite? Only one. Okay. Did you know that at one point in your life in Cavite, there was high fluoridation in water? Not many people know that there is fluoride in the water system in your country. Maybe it's a good way to check if you have kids. Why? Because when they're young, there was a time in Cavite and in Canada that the government put so much fluoride, it created its own disease, which we call fluorosis. Okay, have you seen this one before? Yeah. Sorry. This one? Do you have this one? Or have you seen anyone who have a little bit of whitish part on their teeth? Worst case scenario, the severe one have some pitted, brown, deep cavitation on the teeth. This is not just simple discoloration. This is not just coffee stain. This is not just smoking tobacco. This could be fluorosis. And meaning, your tooth is actually weak. And just seemingly, the treatment for this one is still fluoride. So, doctor, so what fluoride should we put? Or what fluoride should we get? Okay? Since we don't have kids anymore, just for the knowledge of the parents, if it's 2 years and below, no fluoride is okay. 6 years and above, 6 months to 2 years, here is 1000 ppm. I would say it's okay without it. But if 2 years to 6 years, you need to check the toothpaste. Is it enough? 1000 ppm. And make sure, can you raise your right finger here? You see this part? Half of this part should be the pea size. Don't give too much for the kids. Being too much is good for a kid. This is giving them bad health later on in life. So just pea size. And for adults, you can put the whole set on your toothpaste and that should be fine. But the most important part is, it should be 1,450 to 1,500 parts per million. So where can you see this? You can see that behind the toothpaste, which you can see later. Okay, so, are you interested in knowing what's the color of this? Sometimes we have this, right? And if you are in the natural part of the world, if you like natural things, this is something that could interest you. Why? Because the color corresponds to certain things. First, red is a mix of natural and chemical. Green means the toothpaste is completely natural. Blue indicates natural composition plus medicine, and black is all chemical. Okay? So, doctor, first question. Which one should I use? Green? Any other answer? Red? Any other answer? For me, the answer is the toothpaste that you will actually use. Why? Because not everyone brush their teeth 2 times a day. If you will not use the toothpaste, there is no point of checking this, okay? So if you're in a natural path, go for the green. If for me, I'll go for the natural with added medicine. For the indications for high fluoride, high rampant caries, if you have a lot of caries, you go for higher concentrations, which the dentist should be giving you, not you buying in the counter. Why? Again, excess fluoride can lead to weaker teeth like fluorosis. Less fluoride, again, can cause weaker teeth. Again, go for tooth decay and all the problems will follow through. Okay? So let's make that clear. How about toothbrush? Which one is better, regular or electronic toothbrush? Why? Cheaper. Another one. Again, same concept. It is the toothbrush that you have to use, okay? If you don't use it, you stuck it in the toilet, what's the point, right? I have patients who bought so many products from us, never use it once. They just wait until they see me every month with their braces adjustment, and I clean for them. I said, what's the point of buying of all of this, okay? So first, use the toothbrush that you will be using. Second, there are some things that you have to consider. First, if it's a teenager, screenagers, lazy teenagers, or lazy people, maybe opt for electronic toothbrush because it's 20 times faster, more efficient than the regular. Can you imagine you brush one stroke, it's just 20, it's like 20 times in the electronic toothbrush. Okay, so you can consider that. But if you have a lot of dental fillings, if you have crowns and bridges, if you have veneers, you cannot use electronic toothbrush. This is something you have to consider because veneers, just like the Miss Universe, all of them are wearing veneers. Most of them should not be using electronic toothbrush because the vibration of that is so strong, it can break the cement, break everything inside. Same goes if you have a lot of tooth fillings. Okay, so count. 1, 2, more than one is many. Many, doctor. I have many tooth fillings, okay? Even just, if you have, especially on this side, on the cheek side, if you have that, don't use it, okay? More efficient, less expensive, regular toothbrush, okay? But if you have braces, who among you have braces here? Not much, okay? I see. Okay, in Macau, I would say 50% of population is wearing braces, so I'm a bit surprised, okay? But here, if you have braces, if you have friends, there's a special toothbrush called interdental brush. It's specifically for the braces, and you change it just like a regular toothbrush, okay? Once you feel that your toothbrush is ugly already, change it. Be it 3 months, 1 week, 2 weeks, 3 weeks. It's up to you to decide. As long as you change it, or else you're just hurting your gums. Okay. Alright. So, what time is it now? 4:16. Okay, maybe I'll end in the next few minutes with HIV, alright? One of my favorite verse also comes from Ecclesiastes 3:14. Can you read it? I know that everything God does will endure forever. Nothing can be added to it and nothing taken from it. God does it so that the people will fear Him. And did you know that your teeth are meant to last a lifetime? Even if this, I hope not this one, maybe if you get burned, all of your body get burned, the forensic will always check for what? Teeth. Why? Because it is the strong strongest bone in your body. The enamel, the white covering, is the strongest of them all. But it doesn't mean it is indestructible. Even Satan can destroy us if we are not strong. What more for the teeth? We need to protect it because God made it so strong. All you need to do is at least brush it. Okay? So, here, in Proverbs 19:16, can we also read together? He that keepeth... I'm so sorry. I'm not used to it. Again. Proverbs 19:16. He that keepeth the commandment keepeth his own soul, but he that despises his ways shall die. In relation to dentistry, whoever just ignoring God's guidance leads you to consequences. And just like with the teeth, you lose it. You feel discomfort, you feel sad, you feel pain, you suffer at some point, okay? And these are the common phrases that I hear. Doctor, I did not come for 4 years because why? I'm very busy. Did you say that before? How about I don't have time? I said, how many times do you have in a day? I think we have the same, right? Or I take care of the kids, just like me. I have 2 kids and I'm very hands-on with 2 of our businesses, 2 kids. But I still try my best. Okay, why? Giving an excuse is a sin. Okay? Try to help yourself. Try to protect yourself because neglection is a bad thing. Okay? Last but not the least, okay, I'll go for this one. I'll just end this one. I actually still have more. But I just want to show you this one. HIV oral issues because I do some lectures on this. And I check this every day with my patient. I want to ask, is HIV scary?
Yes.
Do you want to have HIV?
No.
Then how can we prevent that? Okay, first, again, later if you have a friend, ask them to open their mouth and, brother, sister, can you check, do I have mouth ulcers? Okay, where do you get mouth ulcers? By eating fast. You beat your tongue, you beat your lips, you beat your cheek. Second, eating spicy food. Okay, it hurts the gums. Third, maybe if you have braces, it's poking here. But most importantly, you can have mouth ulcers if, sorry, for the Filipinos, singaw po in Tagalog. Singaw ang mouth ulcers, okay? If you have this, maybe your immune system is down. Okay, why? Because your body cannot combat this bacteria. And so, if your body is down, it is indicating something. And here, during the coronavirus in 2019, the HIV patients had a hard time actually dealing with their cases. And the emergency department shows that it impacted them because from simple HIV, they turned to AIDS that time. But here are the not clear, but at least some signs that you need to look after. Maybe if you're gonna date someone soon, I'm so sorry, can I check your tongue first? Or maybe can I check your cheeks? Do you have ulcer? Do you brush your teeth? Okay? Alright, so let's go back. First in the uvula. You'll see. Second is check the side of the tongue. So even if my patient comes in just for braces, I will still check it. Why? I don't want to have HIV. That's one thing. Okay, second, I want to help my patient. If they have this, then they will not progress to more serious problems. So, hairy leukoplakia, it's like a white thing on the side of the tongue. Later, I want you to look at the mirror. Do I have white thing here? As his sister is doing like this. You need the mirror, sister. Check there. Okay, you have to check both sides. Do I have white? But don't be confused. Maybe you drank milk, you ate cheese. You have to brush first before checking, okay? Check if you have hairy leukoplakia because this is a very telltale sign for us. Another one, if you have mouth ulcers, okay? Who loves drinking hot soup here? To the point when you drink, ouch, I burned my palatal area, okay? It's okay. Sometimes this is really the cause. Especially if you will eat hot papaitan, hot bulalo. In Macau, there's many Filipino restaurants are good in hot dishes. But if this mouth ulcer is because of the hot soup that you just burned yourself with, if this did not heal for 14 days, you may have a problem. Why? Because again, your immune system is so down, it cannot heal itself. God made sure that you will heal yourself. Usually in the dental part is 7 or 10 to 14 days fully healed, unless you have more severe problems. So, if you have this problem, you must do a swab test. Yes, not for COVID. We don't like that. That's so painful. I cannot breathe with that. I cannot deal with that. But swab test for any cancer, cysts and tumors of the jaw, possible HIV, and have it checked. Because some people will have certain situations like this. These are serious complications with dentistry that we don't usually see on a daily basis, but as a hospital dentist, I see this, I smell this. Meaning, it's really stinky. Meaning, it's really deforming, debilitating for the patient. If you ignore small signs, swollen signs, a little bit of pain, maybe one day, which we don't like to happen, it will get more serious like this one. This is a melanoblastoma. Maybe originating from a tooth cavity, maybe not. But look at the x-ray. It eats all of the bone already. Just because this patient ignored the signs from a small lump to getting bigger and bigger. And some people, especially the older ones, they don't like taking x-rays. Can you imagine that this face is the same as that? You'll think this one have more mass. On the inside, it's already eaten by some bacteria, tumors, and cysts of the jaws. And so, want to end things on this one? Get checked. If the dentist asks you to do x-ray, do x-ray. If you will have this excuse that, I don't want to undergo radiation. Sure, but do you take the plane? It's the same thing when you take the plane back to your home. That's the same radiation you get with an x-ray. And how many times do we take the plane? How many times do you watch TV? Your phone, these things give small types of radiation. So simple things like this, we have to do, okay? Don't think that it's expensive because like this one, the patient had to remove his half of the jaw, go back to the hospital so many times and put a plate. And forever, speech is affected, digestion is affected, feeding is affected, and personally, the patient is not happy living in this state. Okay? So, simple as this, you have to take care. And lastly, this is very important, dental plaque. Did you know that dental plaque can actually cause heart disease? Which is the leading cause of death worldwide. How many of you, uncles, relatives have died because of heart disease? No? Heart attack. In Filipinos, usually they know heart attack, cardiovascular, no? So, some studies show that from the plaque that you saw a while ago, the dirty plaque on the teeth goes into the body, goes to the heart, and then block the heart gradually. So, if you feel like you are so lazy, always think about it. I don't want to have a heart attack. I want to be healthy for my family. So, simple brushing, getting your teeth checked to the dentist. If you feel a little bit of discomfort, please do because it is for you. And prevention is better than cure. Okay, in conclusion, healthy mouth is equals to healthy body. And it's your way of following God in preserving and taking care of God's temple, which is your body. So, to end this, I want to remind everyone that behind every smile, there's teeth. Can you imagine life without it? Thank you so much, and I hope to see you on May 1, and I hope you learned something today.